My final research topic is physical inactivity as a public health concern. In order to discuss physical inactivity, we must first talk about what physical activity is. Physical activity is anything that gets your body moving. It is not the same as exercise. Exercise is the intention of committing physical activity for health benefits such as increased muscle mass or increased cardiovascular endurance. Physical inactivity, on the other hand, is lack thereof physical activity, which is just getting your body moving. Why should we all be physically active? There are plenty of health benefits that can be seen from being physically active, all the way from a decreased risk for many different health concerns such as high blood pressure, certain cancers, anxiety, depression, coronary heart disease, obesity, as well as type 2 diabetes. This video, produced from the European Society of Cardiology, discusses physical activity in ways to be more physically active to lead a healthier life. This video, produced from the European Society of Cardiology, discusses physical activity in ways to be more physically active to lead a healthier life. Now that we know what physical inactivity is, let's look at prevalence and incidence. 48.6% of Nevada residents fail to get 30 plus minutes of moderate physical activity 5 or more days per week. As we know, this is the minimum requirement for preventing health risks such as coronary disease and depression, just for example. According to this logic, nearly half of Nevada residents are at risk. If we look at it on a more worldwide scale, 60 to 85% of people in the world from both developed countries and developing countries lead sedentary lifestyles, meaning they don't get as much physical activity as they should, and nearly 2/3 of children are also insufficiently active. This is a scary statistic because more than half, even just on a local and a worldwide level, of people are not being as physically active, meaning they are putting themselves at risk for the previously stated risks. Now let's look at trends in health data. Now, as we've looked at before from the CDC, the Behavioral Risk Factor Surveillance System surveyed residents of Nevada. Now, according to the chart on the right, we can see clearly as an individual's age increases, the amount of physical activity they participate in decreases. Now, when you think about it as somebody who is working all their life goes into retirement, you'd think now they'd have the time to be participating in physical activity and meeting the minimum requirements. This is not the case. As you can see from the chart, the age group of 65 plus responded that they get the least amount of physical activity, meaning they don't meet the requirements. Now, compared to all the other age groups, it's very clear that they get the least amount of exercise, which is very dangerous because those are the years that you're beginning to see all these risk factors become an actual condition, such as heart disease, diabetes, and so many other risk factors that could have been prevented by physical activity. Statistically speaking, some groups are more inclined to lead less physically active lifestyles than others. Women are more likely to be inactive than men. In addition, Hispanic and African American adults are more likely to be inactive compared to non-Hispanic Caucasian adults. The issue of physical inactivity has been widely known to be caused from just an increase in technology from all the advancements we've had within the last few years. Now, iPhones and iPads are hugely common in most households, and most people would rather be relaxing and playing on them than to be physically active and walking through a park. Now, there are multiple ways to address this issue. There are a couple prevention strategies. My favorite being the Pokemon Go app. There was this amazing study that looked at how Pokemon Go has made huge strides compared to any other app in reducing physical inactivity. This is because the app revolves around the idea that you are rewarded by getting moving. In Pokemon Go, you are rewarded the more walking you do, which it measures on the app. Now, there has been some debate as to whether the app is more harmful than it is good because it is causing people to kind of mindlessly wander into areas they shouldn't and not pay attention to their surroundings. But when you look at the fact that people are more than ever with this app getting outside and getting active, the positives outweigh the negatives. In addition, a more traditional way to address this problem would be to build more parks, build more accessibility for everyone in the community. A lot of people stay inside because they do not feel safe in their neighborhoods. Now, most families who live in unsafe neighborhoods, they don't want their children to go playing outside. They'd rather them not get the physical activity they should be getting and stay inside and stay safe on their iPads or TVs or whatever it be. If there were more safe parks available to everyone and accessible, we'd have more kids and more adults getting outside and getting the proper amount of physical activity. In conclusion, physical inactivity is a huge public health concern that can be easily solved. Participating in regular physical activity is the cheapest and best preventative medicine available to everyone. You don't need expensive equipment, you do not need an expensive gym membership, you just have to get your body moving. Whether that be walking through a mall, walking your dog through the park, or even gardening in your backyard, those all count as physical activity that gets your body moving, especially when you consider how much preventative action you are taking by preventing and lowering your risk for heart disease, diabetes, anxiety, and depression. Everyone should be getting the adequate amount of physical activity every single day. It's that simple.